Welcome to the Food Junkies podcast. Here, we aim to bring you the experience, strength, and hope of professionals working on the front lines in the field of food addiction. Our mission is to educate you, the listener, and increase overall awareness about food addiction as a recognized disorder. Here, we discuss all things recovery, exploring the many pathways people take towards abstinence in order to achieve a health-forward lifestyle. We hope to inspire you to thrive rather than just survive. So stay positive, make a change for yourself, and share your journey with others. And hopefully the message will spread.
Grassroots mobilization. How can we, the people, push our message of food addiction forward? Welcome to the Food Junkies podcast. My name is Dr. Vera Tarman, and I am your host, speaking with leading expert in grassroots mobilization, Chérie St. Arnauld. Chérie St. Arnauld is a committed advocate for metabolic health and the Executive Director of Metabolic Revolution, a nonpartisan organization on a mission to spread awareness about the powerful healing that metabolic therapies provide, advancing a new health paradigm that addresses the root causes of chronic disease. Cherie's journey into metabolic health began when she was just a child, witnessing the miracle of her sister reversing a terminal cancer diagnosis, an intervention that gave her 10 more years of life, an experience that forever shaped not only Cherie's personal health journey, but inspired or instilled in her a deep and lasting conviction about the powerful connection between food and healing. At Metabolic Revolution, Cherie leads efforts to transform nutrition and healthcare policy. I became aware of her when I was asked to sign her petition, Ban Ultra-Processed Foods from School Meals. Then I found out about her organization, Metabolic Revolution, and how it produced the country's first ever rally for metabolic health in October 24 at the Washington Monument. Here, Metabolic Revolution had speakers such as Robert Lustig and Chris Palmer demand that presidential policies address chronic disease and introduce science-based dietary guidelines and direct healthcare reform to focus on root causes of disease rather than symptoms. This is grassroots mobilization that we at Food Junkies can learn from. Welcome, Cherie.
Thank you so much for having me, Vera. I really appreciate your time today.
Reflecting on your childhood, could you tell us how growing up consuming ultra-processed foods influenced your relationship with food and health?
Yeah, so I grew up in a household where we ate almost exclusively all ultra-processed foods, just from a time, I should say maybe economic constraint. My family, we were not very well off, but these foods were just a big part of the culture at the time. So I ate all ultra-processed foods until my sister, so she was given 2 weeks to live. This was over the course of a couple of years, battling a rare form of cancer. And instead of going down the route of yet another experimental form of chemotherapy, my dad and my parents, they made the radical choice to embrace a completely different diet that was a 180 from ultra-processed foods. Because both of my parents, they decided that they didn't want my sister's last weeks or months of life to just be sick until she had no more time left. So they decided to try something completely different. And I remember my mother saying that they went back to the doctors and they said, whatever you're doing, just keep doing it. So she drank a specific tea. And then our diet, we all try to incorporate as much organic food and locally grown food as much as possible. So it's pretty much the polar opposite of the ultra-processed foods that I had been eating my entire life. And that was when I really, I felt like I came to life, everything changed. I was able to run the mile for the first time. I made friends that I consider family to this day, and I'm in good health. I found great health, which is just incredible.
And that was a whole food diet. And then I understand that you went to a keto diet as well at some point?
Yeah, I recently started implementing a ketogenic diet ever since learning about the mental health aspects, the
Okay.
benefits that can ensue. When I first met Just Apple, I was only starting to scratch the surface. There's a nonprofit that's an initiative from the Bazooki Group. It's called Metabolic Mind, and they fund a lot of the research in the space. And Jess, she shared her story of her anxiety going from a scream to a whisper.
Oh, wow.
And I've definitely struggled with anxiety throughout my life. As of late, I feel like it's been pretty manageable. I learned tools throughout my life to help manage that. But when I heard Jess say this, I thought, oh my gosh, this was the catalyst for me trying it myself. And I've never felt as much mental clarity or peace as I have ever since implementing the diet.
And what happened to your sister?
She gained 10 more years of her life, and then later on, she developed colon cancer, and that's what ended up taking her life. She had 3 different types of cancers throughout her life. And when she went on experimental chemotherapy when she was very young, they said that when she goes through hormonal changes, that something might pop up. And so when puberty hit, something popped up. And then when she became pregnant, that was when she got colon cancer.
Wow. Tell us about your career development, how you eventually got to being working where you are now at Metabolic Revolution.
Yeah, so I'll rewind a bit just to share a bit of the journey. So I was previously in financial services. So I was the first in my family to go to college, and I thought, okay, I need to pick something that will provide some sort of economic security. So I did that, and I always wanted to go back to school, not only for the career opportunities, but also for the personal experience, because throughout undergrad, I worked. So I never really gave myself the space to pursue what it was I was really passionate about. I didn't really ever dive into that. So I went back to school, and I found the healthcare industry. I had no idea that you could go into it as like a business administrator. I only thought that you could be a doctor or a nurse. So I went into healthcare consulting, and that was when I really learned how the US healthcare system worked. And consulting, it was great, but it definitely can leave you burnt out. And I noticed my own health starting to dip because 6 hours of sleep, constant stress, your relationships can suffer. It's definitely tough. So I left, and I let myself do whatever I wanted for perhaps a month, 2 months. I started writing about food. And then I found the food as medicine space, which is how can we integrate food as a tool within our US healthcare system? And I thought, oh my gosh, I can't believe that this is happening. This is made for me because I've always loved food. And I'll share more about that perhaps in a bit if we have more time. But I found this space, and I just dove in. I started writing about it. I started looking for my next career move within it, and I started consulting within it. I just became an expert through conversations, like primary and secondary research, what I learned in consulting. And I started working at the Food is Medicine Network just for a brief moment. And throughout my research, that was when I learned about ketogenic metabolic therapies for not only chronic disease management, but it's chronic disease reversal. That was what led me to join Metabolic Revolution. A woman named Julie King, she saw my writing and my frustration within the food is medicine space, because it's great in the sense that when you talk to a payer, a health insurance company, and say you have an app and you're saying, hey, please take a look at this. This will not only get your population healthier, it will lower your costs. Exactly. And that was when I started to say, oh my gosh, like this is the answer. This is food as medicine. And it's so difficult because it's really hard to integrate food as a tool within our healthcare system. There are so many industry forces that make it so that it's incredibly difficult.
As you mentioned, there's doctors and nurses and researchers, and then there's the people themselves. And your work is in advocacy. If you can advocate that an insurance company would take an app that supports preventative health, that's advocacy on a management level, isn't it?
Yes, because I think that this is my North Star. If the evidence is so compelling, it becomes, I don't want to say irresponsible. I don't know what the right word is, but it becomes, you can't deny it. It becomes something that you need to, like a responsibility to implement if the data is that compelling. Dr. Tro's program, I forget how many medications people typically came off of, but this is...
Which should be enticing to an insurance company, shouldn't it? So what happened? You were only there for a minute. Was it because it was too frustrating that despite the obvious benefit, they still didn't listen?
What I was trying to do once I learned about ketogenic metabolic therapies, I was trying to bring that group over into the food as medicine space. And it was very difficult to blend those groups because a lot of individuals in the ketogenic metabolic therapy space, they have been trying to get payers to implement this for years and years. And I think that they maybe, I don't want to say a waste of time, but you have to...
A lot of politicking.
Yeah, there's only so much time. And I think that the food as medicine space, there are a lot of great initiatives. There's a lot of great work from that, like individuals are doing, that organizations are doing. But some of it, I started to think that it was almost like in little pockets, like food as medicine washing, like akin to greenwashing. Oh, we're doing this over here, so you don't see what we're doing over there.
Yeah.
And that was where I found the most resistance. Like people were like, I don't want to have anything to do with that, which I understand.
But then Metabolic Revolution is a better fit for you.
Oh my gosh, it's 100%.
Tell us, what are they doing and what are you doing in that program?
Yeah, so what we're doing, we are a grassroots organization through and through.
Yeah, no more middle management stuff.
Exactly. So it's built to empower individuals and communities to lead their way to health. There isn't that much within our current infrastructure. It's difficult to have change come from top down just because industry is so powerful. So what we're doing is we're helping people share their voice, share their experience, and just get people demanding change from their institutions. And this, I think, is so powerful because it's not only about increasing education and awareness, it's about helping individuals realize that they can demand change. And then hopefully that creates collective action. So then change happens from the top down because you can either alter the supply or the demand. And if demand is strong enough, then supply will have to follow suit.
I think what you're saying intuitively, a lot of us know, but we don't know how to do it. And so there you are with Metabolic Revolution. And I'm aware of at least two initiatives, the ban petition that you sent off and then the Capitol Hill event. So can you tell us about those and how did you mobilize? How did you make that happen?
Yeah, so the event, that was all Jess Apple, one of the co-founders of Metabolic Revolution. She saw that there was an event going on in DC where all of the speakers were attending or speaking at. And she said, I want to have a rally for metabolic health. And she had been volunteering for Dr. Chris Palmer for his Brain Energy Initiative.
You said there was already a Washington monument. Are you talking about the political?
Oh, there was an event going on in DC at the time. I'm not sure what the particular event was.
Okay, but there was something.
There was something going on where all of the speakers would already be in DC. So she said, oh, all these speakers were going to be here.
Yeah.
no, we don't have to make it so that people fly in from everywhere. Everyone will be here so we can have the rally. That was how it came about. She just saw an opportunity and was like, I need to make this happen. And this is the thing that I'm so grateful for to work with.
What did it look like, the event? Were there a lot of people? I know you got some notable speakers.
Yes. Unfortunately, I learned about Metabolic Revolution a month after the event took place. I unfortunately wasn't there, but I heard the most incredible things and have watched all the YouTube videos more than once. And it really is, it's just such a special time and place. I'm hoping that we will be able to have a rally once a year. That would be so incredible, but we'll see. It's like the sky's the limit, but we have finite time and resources, so we have to be selective. But that, I think, would be such an incredible initiative.
And the point of that rally was to demand for a different food plan to acknowledge the root causes of disease like diabetes and obesity. Metabolic Revolution had some specific demands.
Yes, one of the main goals was to demand that our dietary guidelines be based on science rather than industry ties. And a big part of the guidelines, and this is coming from Nina Teicholz's work. She's dedicated a significant amount of her career into digging into the guidelines. People follow the guidelines, and the guidelines are mandatory for certain groups of people I think that are some of the most vulnerable populations, like children, school meals. You have to follow the guidelines. People who are in service, people who are incarcerated, the elderly. The food that is served in these institutions is required by law that they follow the guidelines. And what Metabolic Revolution is saying is at this event it's a call to change, to say that this isn't acceptable. We need our dietary guidelines to be based on science and not influenced by industry. And the other call to action was, I don't know if it's so much a call to action. We need to increase awareness and education of the root cause of the myriad of chronic disease that is insulin resistant. And my journey into from the food as medicine into the metabolic health space, and they're not completely mutually exclusive, but my journey came from an individual named Jim Howard, who was the CEO of Journeys Metabolic. He pointed me to Swiss Re's research. Swiss Re is researching the impact of metabolic health, insulin resistance on the myriad of chronic diseases that ensue. They have a very unique lens or ability to do this research because they have absolutely zero industry ties. Their goal is to reduce the total cost of claims from death and disability. So they're a global reinsurer. So they're saying, okay, people are getting sick younger, people are perhaps dying younger. We need to look at what it is that's making this the case. So they're doing a ton of research and work. It's incredible.
What would you determine as parameters of success for a venture like the Washington event? I'm sure that the government didn't change, but there's so many other versions of success. What would be measurable things that you could say, yeah, we did a good job with this event?
Yeah, I think that the biggest thing, and Jess shared this with me, is that everyone just wanted to do something. There was so much energy after the event from volunteers. People were like, we're ready, let's do this. And that was when Jess said, oh my gosh, we need to grow Metabolic Revolution. We need this to become an organization that can support all these individuals and the projects that they want to pursue. And then the other thing I would say is, if you can just reach one person and have the light bulb or the spark of curiosity go off, it can be something that radically changes their life. Just going from a whole foods diet to a ketogenic diet and the mental health benefits that I've experienced, that's life changing. If you can just reach one person, I would say that's a success.
Yeah. So that event mobilized a lot of people who want to help. That's quite successful, especially since you plan to keep doing this annually. And you're actually impacting people's lives personally.
Yes.
What about the school band? How did that happen? How did you think about that? And where were the successes there?
Yeah, we decided, or just decided, because this was also before I joined, when they launched the petition, the thinking was ultra processed foods, it's just a no-brainer. Like, this is something that we shouldn't serve in school when the alternative is so much better. We thought that, okay, we're metabolic health, the ketogenic diet it supports that, but that might be a bit more difficult to get people to sign on to. Whereas ultra processed foods, it's like everyone understands that. Everyone thinks, okay, we shouldn't serve this in school meals. So that was what led us to pick ultra processed foods for the petition. And it's been successful. It's tough because I would say that the success would be if we could get a school or several schools or a national strategy to make it so that ultra processed foods aren't served. That would be an immense success. But the fact that people are sharing and talking about it and signing.
Yeah, I didn't realize that the school has to go by the national guidelines, but it sounds you're getting schools talking, you're getting parents talking, and that's a huge success right there.
It's huge. And we have a volunteer-led school lunch committee that came out from this initiative. And what they're doing is they're working on developing a permission structure for parents and school administrators if they want to opt into a diet that doesn't follow the guideline, or I shouldn't say doesn't follow the guidelines. It still follows the guidelines, but it's like a special route if parents or school administrators want to serve perhaps like a higher fat, higher protein, and lower carbohydrate meal for their students. And that's a project that they're leading, which is so it's really incredible to be able to have a volunteer project under the umbrella of Metabolic Revolution.
That's a great example of grassroots mobilization right there.
Yes.
Now, your organization took recent action regarding ketogenic therapy research for schizophrenia at University of Maryland. Can you tell us about that? That sounds like another example of grassroots mobilization.
Yes. So there was a study that was halted. So Jess started doing research and trying to figure out how we could get information, communications that would maybe share information as to why the study was halted, because there was no explanation. And so Jess, she's figuring out how to get this information, where to submit, and we worked with an incredible lawyer. Her name's Amy Laughlin. She recently joined Metabolic Revolution's board of directors. She took on the work that Jess was doing and she filed a PIA request to get information into why the research was halted. And then the next day, the secretary resigned. And we don't know what happened. We're holding off because there are efforts to get the study back on track. So we don't think that it's necessary to put resources into learning why, because all we want is for the study to get back on track.
Did you want to say a little bit more about why you think that ketogenic research into mental health is pretty important?
Yes. Oh my gosh, I'm so happy you asked this. This study is so important because it was in a setting where you could see what people were eating every day, where you had a measure on it. So it was more rigorous. It has stronger evidence, a stronger standard of evidence And that was why it's so important for this study to continue. But then ketogenic therapy related to mental health, any study that utilizes food as a tool, it's so important, especially when it's this rigorous of a study. It's so important because there aren't that many. Any study that we have, it's so important that it is able to be conducted.
Why is it so important to investigate a ketogenic diet in relation to mental health?
Yes, because it's been the few studies, there aren't that many, but there are some that exist and there are some that are being funded. Right now, I would love to point listeners to a website called Metabolic Mind. They're doing a lot of research. They actually have a page where they show the studies. There's a timeline for studies that were conducted, the initial study. I don't think it was so long ago, specific for, I think it could be bipolar or schizophrenia. I'm not sure, but related to a mental health disorder. And the reason why I'm personally so passionate about it is because my mother struggled with mental health throughout her life. For people who are treatment resistant, this is life changing. And my hope would be that diet can be used as a first line of therapy as opposed to a last, because of the complications from medications, and there are sometimes side effects, and then side effects when you're on multiple medications. And I saw this with my mother. I saw her struggle with it for her entire life. And it's something that I had absolutely no idea about until I really started digging into the food as medicine space, and then later the metabolic health space.
Okay, good. Now, a question about the GLP-1. So you highlighted a study that showed significant weight loss, like 15%, without GLP-1 injections. And why is that relevant to your mission?
Yeah, so it's relevant to our mission to share these studies with individuals so that they know that there's another option, that you don't need to go on GLP-1s necessarily, that you can utilize a ketogenic diet for weight loss, type 2 diabetes, so many things. Dr. Tro's study he recently shared, and his program, it's just incredible to have that many medications that people are able to come off of. That's huge. And we're coordinating a walk for metabolic health in partnership with Dr. Tro. We're still waiting to have the date solidified because he's extremely busy and trying to get everyone together, but it will be sometime in the summer or early fall.
And that's another example of a community mobilization. So you've talked about the big rally. We talked about a petition, ensuring that research is not stopped. And now you're talking about a walk to support the keto platform.
Yeah, we have a lot of initiatives, and it's like the sky's the limit. And there's so many areas where everything intersects. And it's incredible.
So how do you get people to coordinate, to rally? Because as I said, a lot of us know that we want to speak out, and we know it has to come from the community because it's not going to come from big business, but we don't know how to actually make that happen. We don't know what to do. So how do you get people like me involved?
Yes, this is something that is so powerful that I learned from Jess, and it's people's voices are, if you give people the space for their own voice and to share their own story, like everyone, it creates this excitement and it can be so powerful. So at the rally, we didn't only have experts speak, but we had a parade of proof. So this is where individuals got on stage and for 45 seconds, they said, hey, this is my story. And it could be related to anything, just weight loss, well-being. It could be mental health. It could be PCOS. Take any chronic disease stemming from insulin resistance. So many people have their own story to share. And we launched a virtual parade of proof through vocal video to make it so that we just launched it to make it so that people who weren't able to attend the rally can share their story and continue sharing these stories. And you never know whose story is going to resonate with who. And then that can be the spark for that individual in their own health journey.
I think it's a great idea. A parade. It's only 45 seconds, so it's not like you're listening to somebody on and on, but you get vignettes, one after the other.
Yes.
Yeah.
I had this idea that if we could, our website wouldn't support it, but if we could just have like endless videos of parade of proof and count the amount of hours, and then you can then share that with institutions and say, hey, we have 3 days worth of videos of people sharing
It's like a living petition, isn't it?
Yes.
Wow, that's really interesting. And the interesting thing too is when a person gives 45 seconds of their story, they're committed now because they've told something about themselves. And so you've got them now on the team.
Yes. It's deeply personal. And this is something that I think is so powerful. The emotion that comes with it, it's so powerful.
So do you feel that community mobilization is the way to go? And are you enjoying it? Do you think it's going to have an impact?
So I'm enjoying it so much because I wasn't in the position where I was frustrated by the system for so long. Like I didn't have a startup utilizing ketogenic metabolic therapy and have that immense frustration trying to figure out how to integrate it into the healthcare system. But I had a little bit of time where I was just like, I don't know how to describe it. This frustration of we have the answer, but why isn't it something that's offered to us? And so I'm enjoying the opposite side so much because I feel like there's more hope. And I feel like this is the way that it has to come about because, again, industry is so powerful and no politician was ever voted or re-voted into office when jobs were lost. And I think that's such a big thing. I feel very strongly that individuals can collectively create like a new economy that supports metabolic health.
Yeah. Wow. What I'm thinking about is the tobacco industry, that we had to mobilize from a community level. Do you see this as a parallel to the tobacco industry?
Yes. So much. I think that the one tricky thing is that it's food as opposed to a substance, and food is something that people need.
Yeah, but don't need ultra processed food.
Exactly. So I feel hopeful that there will be something that makes it so that change has to happen. And when I say change, something that really, I don't know if disrupts is the right word, but something that makes it so that we understand that this is poison. It's either, okay, we're not allowed to make this and sell it, or at least there's a huge label that says this might create immense.
Could you see your organization as being part of a movement to force big food to put little pictures of diabetic feet, and the same way as cigarettes now have to show pictures of cancerous lungs? Would that be a community mobilization effort?
Yeah, we have our toes dipping a bit into policy advocacy. Something that we are trying to do. We're still exploring how we could make this happen, but working with a state legislator to draft a resolution that then the state legislator hands over to the state attorney general to launch an investigation into big food, either through formulations or marketing practices, basically saying, hey, we need to investigate big food and the associated healthcare costs that are a burden to our state, a growing burden to our state from a Medicaid perspective. And if that one state attorney general does launch an investigation into big food, then other states could perhaps do the same. And then there could be a master settlement agreement that's similar to what happened with big tobacco years ago. That would be ideal. And then where grassroots mobilization comes in is, say, the state attorney general doesn't launch an investigation, then Metabolic Revolution, we can reach out to volunteers in that state and say, hey, we need to rally for the attorney general to launch this.
That would be the same with getting the state legislature to consider taxing as well, because that was a big issue as well as cigarettes. They just got so expensive because of the taxes.
Disincentivizing people to purchase. Yes.
So the grassroots mobilization, again, would be to push the policy makers to actually suggesting these as policies.
Exactly.
That would be through rallies or petitions or this parade of proof.
Yes, rallies and petitions, definitely. And I love that this is a great idea because we could share all of the parade of proofs, but maybe specific ones related to ultra-processed foods.
Yeah. I'd like to see what we in the food addiction world can learn. Obviously, a lot of our concerns are the same as your concerns because ultra-processed food is highly addictive along with being metabolically damaging. And I just wonder if there's a way that we can mobilize or use grassroots, that food addiction is as relevant of an addiction as is tobacco addiction, as is cocaine addiction, alcohol addiction. And so therefore, once that's acknowledged, then there'll be insurance for treatment. Then there'll be just better studies because we'll actually have a diagnosable condition that we can study.
I think that the link between research and individual stories is really powerful because if you can share with whoever is reviewing, anyone in policy or in industry, if you can share, this is the research and these are individuals who have been impacted, and then maybe also bring to light the cost, basically make it so that it's undeniable, and then get individuals riled up to say, oh my gosh, we need to have change happen because say they were suffering from food addiction and then they wound up having chronic disease for various chronic diseases and then their life was impacted. I think that getting all of those personal stories and getting people together to share their personal stories, that can maybe be the catalyst for change. Because if you see something on paper, it's not as real as it is when someone is sharing their story. And also something I've learned is that there's such a force. It's not only within individual stories, but people, they always have connections or ideas, and then these can grow into something bigger. And then it's all of a sudden you have this momentum.
One thing I'm thinking, and tell me if this would work, is we should have a diabetes day or some kind of a day. And then on that day, a kind of rally. And then we have the proof of parade of people speaking about that. Make a sugar addiction day.
I would love to share my story. When I was younger, I was addicted to, my parents didn't really watch me, so I would just go and eat 6 cupcakes and then just feel terrible. Terrible.
Yeah.
My brain was just going and I couldn't get it to quiet or calm. Like it's crazy.
Yeah, I'm just thinking now, Halloween is a day basically to celebrate candy. And on that day, I'm just trying to use some of your ideas that there be a rally against the food industry and their investment into Halloween.
Gosh, their investment into getting kids hooked. Yes.
It's a hard sell to the public because they don't acknowledge sugar as a problem. And professionals don't even acknowledge sugar as a problem. That's what you're talking about. Here we've got this metabolic solution, and the bariatric physicians and the obesity doctors, except for people like Dr. Tro, don't get it. They're prescribing GLP-1s and telling people to increase their insulin so they can eat candy or cake. And of course, the big food industry is not going to support it either. Yeah. So your group isn't really the policy level. It's below that. It's to influence the policy level.
Yes, we have the bottom-up approach, and then we have like a little baby toe dipped into a couple things that we could perhaps do from some sort of initiative, like working with a state legislator one or two things like that. But it's grassroots mobilization.
What other things besides the petition and the rally could we consider that you would see using at Metabolic Revolution?
Community events is huge. So the Walk for Metabolic Health, ideally we'll have, I think the idea is to have more than one, but we have to get the first one going. A Walk for Metabolic Health is, I think that's a great one, but just community-based events overall. So you could have a walk to increase awareness and education. Community events, we have one in partnership with Dr. Tony Hampton to help educate and strengthen the African American community in Chicago. So Chicago is where Tony has his practice. We reached out to him because there is just so much distrust that the African American community has for our healthcare system because they've been treated terrible, called non-compliant. And when you look at, so my partner and I, his work is based in Chicago. So we're in San Francisco. We live here, but we travel to Chicago for his work. And it's crazy where we live. It's very close to some of the older housing projects. And you walk around and you just see people with missing limbs and wheelchairs.
Yeah.
It's like, how did we get to a point where this is okay? And the thing that I love so much about Tony Hampton is he has incredible YouTube videos, and he has videos where he helps individuals like learn. And he says, go to your healthcare provider and say, I want a lifestyle-based approach. So that's grassroots. That's community building, that's empowerment, that's everything right there. Because he's saying you can go to your healthcare professional and you can demand change. And that's our goal of this community event, is to educate individuals about metabolic health and say, now go to your healthcare professional and say, I need this.
You're giving me some great ideas. For example, a walkathon is not as political as a march. It's just a walk. And people will wonder, what are all these people? And the walk could be about ultra-processed food and the health benefits of stopping. That could be the walk. Or there could be a community event, like hire a space at the college and then advertise this as this is the place to go to get information, to get resources, and then to have some version of a parade of proof as well. Yeah, that's doable.
Yeah, that's the thing. Like, I don't want to say it's not that hard. It takes a lot of work. It's not that crazy.
I'm thinking about like Women's Day or even Gay Pride. It started off being a picnic at the park, and then it grew to be a huge parade over the years. And similarly with International Women's Day. So why don't we do something like that in this field?
Yes. I don't know if there's a day for metabolic health, but we can create one. Maybe it should be October 13th, which was when the rally took place.
Yeah.
That would be incredible.
Yeah. Wow. Yeah. Okay, I don't know if this is a fair question to ask, but given the current political climate, are you still as optimistic or motivated, or what do you think?
Yeah, our approach is that you are our partner until there's something that you do that makes us think otherwise. We're still waiting-ish to see what the administration does.
Yeah.
I don't think that any real change will come from it because, again, industry is so powerful. We'll see.
Yeah.
But our approach is to work together until we are convinced otherwise.
Yeah, that makes sense.
And then that's when we'll go out and say, hey, this isn't okay. Especially when it comes to individuals in politics. Like, if you say, yes, my goal is to remove ultra-processed foods from school, and it's on record of you saying that and saying that it's not something that we're going to accept, okay, let's see what actions are taken. And if no actions are taken, then
you can hold them accountable.
Exactly.
Yeah, through a protest or something. Yeah. Is there anything else that you want to say about Metabolic Revolution or about your hopes in the work that you're doing?
Oh my gosh. Yes, my hope is that people become aware that there's growing awareness of metabolic health and that people are equipped with the tools with the knowledge and the resources to lead their own way to health. And it's difficult if you're on medications. It's important to be able to work with a doctor to come off of those medications, ideally in a way that's safe. But the main takeaway is that we have it in our power. We have health within our power. And whatever we're going through, if people aren't healthy or if they just want to take some sort of prevention, or in my case, they just want to thrive, I think that it's just really important that people are aware, and that people who have found that information, who have found their way to health, share their story.
Yeah.
And share the resources that they leaned on. Achieve change within our current system, we have to demand it. We have to just accept nothing else. Like when it comes to food, don't forget ultra processed foods. This food environment is the fad diet. It's not a ketogenic diet. No, we didn't evolve with Frosted Flakes in the grocery store. Our bodies aren't equipped to handle that.
And we have to do it. And we have done it in the past. We've done it with tobacco, and we're in the process of doing it with the opiate epidemic. People are finally saying enough is enough and starting to sue the companies. Yeah.
And the last thing I want people to take away is that, like, it might seem like you have to go out of your way to source good quality food, but it's possible. Like, you can vote with your dollar. If no one was buying ultra processed foods, they would have to go away. So we have it in our power. For some people, it's really difficult. I remember when I was younger, I didn't have a full kitchen for a couple of years, and it was difficult. It was really hard to eat healthy. I went out of my way to do it, but I believe so much in the power of food. I think if you make those little changes, they can add up to bigger changes because you feel better. And then all of a sudden, I felt like my life changed as a result of going out of my way little by little to just eat better.
Last question is our signature question. And that is, if you could tell a younger version of yourself about community organizing or about metabolic health, what would it be?
Yes, 2 things. Learn what community organizing is. I had no idea when I was younger. And then 2 would be for me to embrace my rebellious nature rather than trying to.
Love it. Embrace the rebellious nature, or make it work for you. I love it.
Thank you.
Okay. Thank you so much for spending time with us today.
Thank you so much, Vera. It was so incredible. I really appreciate it.
Thanks for joining us this week on Food Junkies Recovery from Food Addiction. Make sure to join our Facebook group, Sugar Free for Life Support Group, I'm Sweet Enough. Molly and Clarissa are food addiction professionals who offer one-to-one counseling and group coaching through Sweet Sobriety. Please subscribe to our show so you never miss an episode. While you're at it, if you found value in today's episode, we'd appreciate you leaving us a review on your favorite platform. Your feedback helps grow our show and allows us to reach others who need to hear this message of recovery. Don't forget to pick up a copy of Dr. Tarman's book, Food Junkies. And as Vera always says, the power is ours.